Welcome everyone to this webinar on climate health linkages and infectious disease surveillance. The webinar is hosted by APMEN, the Asia Pacific Malaria Elimination Network, and IMAX, the Institute for Health Modelling and Climate Solutions. So I'm Richard Maud, I'm head of the epidemiology department at Mahidol Oxford Tropical Medicine Research Unit in Bangkok and co-chair of the APMEN Surveillance and Response Working Group. So I'll be moderator for the webinar. So just to introduce the topic, we have three objectives. We would like to provide a common understanding of how climate change is impacting malaria and other climate-sensitive infectious diseases, offer some potential linkages and examples of short-term and long-term incorporation of climate into disease surveillance and health systems, and also introduce the larger framework of climate health policy on the global stage. So before we go into the session itself, we just have a quick overview about the IMAX network from Grace.
Thank you, Richard. Hi, everyone. Nice to meet you. My name's Grace Kim, and I'm joining as a representative from IMAX, the Institute for Health Modeling and Climate Solutions. I manage our IMAX Expert Network, which is a scientific community of practice advancing climate-informed solutions for infectious disease control and elimination, like malaria. And we have a specific emphasis on climate-sensitive diseases. IMAX is a virtual center of excellence that's housed within our larger Forecasting Healthy Futures initiative, which is an initiative that elevates the climate health intersection on the international agenda and promotes proactive solutions like early warning systems or other surveillance tools. And one of our goals as the IMAX network is to convene scientists and practitioners and people working within infectious disease and implementers so that we can stimulate collective learning and ongoing knowledge exchange about practical tools and designs and applications for disease control and elimination programs globally. So this collaboration with the APMEN Surveillance and Response Working Group is a great opportunity to advance this goal, and Professor Richard is actually one of our members of the IMAX Expert Network. So this is a great way for us to collaborate and think about how we can also work together in the future. So thank you for the collaboration and looking forward to learning from you all from the webinar. Back to you, Richard.
Right, thanks, Grace. So some quick mechanics about the webinar. You'll notice the audio and video is disabled for attendees. We have lots of people joining, but you're welcome to comment in the chat box. Please feel free to introduce yourself. I'm reading already some people doing that. But if you have questions for the panelists, we'd be grateful if you could put them in the Q&A box. So that's a separate button at the bottom of the screen. And then we can then see what people have entered, and people can then vote on the questions as well. So if there's something that you see that you like the look of, that you want the panelists to address, please vote. So you can also, it'd be good if you do put a question for a particular panelist, if you can put their name in the question. And right at the end, we'll have a quick poll just to get some feedback about the webinar. So there'll be a few questions that pop up on your screen for that. So without further ado, we'll go to introduce our expert panelists. First off, we have Professor Hilary Bambrick. She's Director of the National Centre for Epidemiology and Population Health at the Australian National University in Canberra. So she's an environmental epidemiologist and bioanthropologist researching the health implications of climate change to better understand risks, impacts, adaptation, and resilience to minimise adverse consequences and reduce health inequalities. So her work is global in scope, but with particular focus on Australia, Asia Pacific, and Ethiopia. She's worked with the WHO and the UNDP and consults for governments in Australia and oversees on impacts assessment and adaptation strategies. So welcome, Hilary. Our next panelist is Max Norman Sitai, who's Principal Meteorologist at the Solomon Islands Meteorological Services and the Ministry of Environment, Climate Change, Disaster Management, Meteorology. So he's worked there for 15 years, and he has expertise in atmospheric and environmental sciences. And it's been instrumental in enhancing climate-related services in the region. He's got a master's degree in atmospheric environmental science from Hankook University in South Korea, and he brings a wealth of knowledge and experience to his role in monitoring and addressing climate issues in the Solomon Islands. So we also have Leonard Boas, who's a good friend of Atman. He's Deputy Director of the Solomon Islands Vector-borne Disease Control Programme in the Ministry of Health and Medical Services. In addition, Alan Porteous is joining us. He's an agricultural climatologist by training. And over the past 15 years, he's been involved in climate services and infrastructure development in the Pacific region, projects including Climate Oceans and Support Programme, funded by the Australian and New Zealand governments, working with 15 different Pacific partner countries and various GCF, GEF, and bilateral programs. And he's currently at the New Zealand focal point for UNEP Climate Information Services 5 Atolls project in the Pacific region. And that project supporting infrastructure and climate service development in 5 low-lying Pacific Atoll countries. And finally, Kaushik Sarkar is Director of IMAX. He's an innovation executive and he leads transformative digital AI initiatives across global health and environmental sectors. By training, he's a physician, but he's turned into an AI strategist with contemporary expertise in population medicine, data science, artificial intelligence, and strategic business alliance. So I'm sure you'll agree, we have an expert panel. We're going to hear from them in a discussion at the end, but we will start with some individual comments and presentations. So first off, we'll go to Professor Hilary Bambrick.
Thank you very much, and thank you to everyone joining from all over the globe by the looks of it. Thank you for the invitation to join today. I'll just give a little bit of background about my work. I've worked in climate change and health for about 25 years, largely amongst more vulnerable populations in Australia and in the Pacific and in Asia and Ethiopia, as was mentioned. So what I've been working on most recently has been much more in the sort of the policy advice space, I suppose, on adaptation to minimise adverse health impacts. So looking at ways to build population resilience, understanding what the climate hazards are and how what the risks are to populations, and working out best ways to make sure that we can adapt as best we can. So particularly from a population health perspective, but also from a health systems perspective as well. It's obviously very complex and all countries have their own challenges. Here in Australia, where heat is a major challenge for us, we're a very large continent, and so we're actually warming more rapidly than the global average. And so extreme heat and associated hazards such as bushfires have been of great significance for us here. In terms of infectious disease, for us, the vector-borne diseases which are of concern, dengue, it's not endemic to Australia, but we do get outbreaks each year, and depending on the climate, it's more or less controllable. But we also have a number of other vector-borne diseases which are possibly not as well known elsewhere. One of them is Ross River virus, and that's a disease that causes or can cause many months of joint pain and fatigue and that kind of thing. So it's not fatal, but it does really knock people around and is quite significant for Australia. So thank you very much. That's all I wanted to say in my introductory remarks, but I understand there'll be some questions later and I'll jump in then. Thank you.
Great, thanks, Hilary. So we're going to set the scene with a talk about the Solomon Islands. So a sudden deep dive with Max Sitai is going to give a presentation. So Max, would you like to go ahead?
Can you all hear me?
Yes, great, we can hear you.
Thank you. Okay. So linking climate and malaria transmission in North Guadalcanal Solomon Islands is my presentation for today. Next slide, please. So a bit on the background, and then linking ENSO, rainfall, and malaria, and using rainfall to forecast malaria transmission, and also a bit on generating categorical malaria warnings, and talk a little bit on the useful findings, and then the malaria early warning system. Next, please. So a bit on the background. So this is a case study that was initiated in 2004 under the Pacific Island Climate Prediction Project, funded by the Australian government and implemented by the Bureau of Meteorology. So there's an international collaboration for data within health and more specifically the vector-borne, looking after malaria for the case study. Is a great challenge when we're trying to carry this case study. However, there is an understanding between the Solomon Islands Med Service and the National Vector-borne, and for national benefit in controlling malaria. So thereon, there is a good partnership that in the end eventuates that we have a product that supports the vector-borne team to help them out with their work. Yeah, next please. Yeah, so firstly, just a quick one on El Nino and La Nina, as they are kind of like the most dominant climate driver that affects the rainfall in Solomon Islands. So as we all know that again in Solomon Islands during El Nino, there is less rainfall. So the idea is mosquitoes have a good breeding ground to develop and then in the end infect humans, while during La Nina, their breeding grounds are disturbed and washed away. So there is a chance that there is less mosquito breeding during La Nina. Okay, so next please. So what is the approach? Bit of a challenge. With the Met Service, we have long-term data during that time, trying to establish a relationship between rainfall and malaria incidents. Yet, with regards to mosquito habitat, during the time there's lack of data, even records of who been infected by mosquito, those that mosquito in fact, there is a lack of number, yet records are there that shows infections at different times of the year. So that is kind of like the challenge that we're facing, but that is the working approach that was carried out to try to come up with a product that can help the vector-borne. Next, please. Yes, so trying to link rainfall towards malaria development. So that's the relationship that was carried out at the time. Okay, thank you. Next one. Yes, so with Honiara being in Goodall Canal, there are two stations that were located within the study area. One is at Honiara, and one is again close to the airport in Transition. However, the Honiara data was mostly used in this case study. Thank you. Move on, please. Yes, so can you give another click just to see the key for that. So anyway, in orange over there, if you look at the Goodall Canal map, that is the study area that was carried out. The greener area over there, more higher grounds, and in gray areas in which are not included much in the study area for coming up with the final product. Yes, that is the key that I would want to be on the screen. So in orange, below 200 millimeter elevation, and within the study area, green above 200 meter elevation, and in gray below 200 meter elevation, but outside of the study area. So mostly that is the study area that was concentrated on, and we say there's for North Guadalcanal. Okay. Yes, so on record, these are annual malaria cases in Guadalcanal from 1982 to 2012. There is a linearity over there, decreasing trend. You can see on the linear line over there, as we are improving in controlling malaria cases. Can you keep on clicking, please? There are okay. So in red over there, that shows years in which you have malaria cases, but then they were occurring during El Nino years. And give another click, there will be, yes, these are showing that years in which record malaria cases during La Nina years. So what you can take out from here is that during La Nina years, there is kind of like a less record of malaria cases compared to El Nino years. So there is a period in which there is more control to preparedness towards tackling malaria cases. So there's a kind of a quick decrease in cases and during the years up to around 2012 and to 13, yeah, 12. So there you can see over there is a sharp decrease that shows more control being taken during those years. Right, so you keep on clicking so that I have the full screen. Yes, thank you. Right, so this is the predicting malaria transmission using rainfall. So these diagrams over here shows we're looking at rainfall from January to December in blue, and then malaria incidents in red. So the target over here is forecasting the rainfall from October to December, which again gives what should be the outlook like for January to June the following year in terms of forecasting or looking at what would be the chances of having malaria cases in those months in that following year. So that is the target in this research. Next, please. Yes, so there's a kind of like a correlation over there in that diagram where you have Honiara rainfall versus the climate-based relative malaria risk in North Guadalcanal. You have a linearity over there. So, and then there's a standardized vulnerability curve that was also put on to see some linearity over there relating to malaria cases and rainfall. Next, continue clicking, please. Sorry. Yeah, continue. Thank you. Yeah, so there are over those graphs, you have no case scenarios. And then you will have also high risk years with rainfall, and then low risk years with rainfall, comparing with the malaria vulnerability in North Guadalcanal. Yes, so What are the useful findings during this research? What we noted was a very dry October to December periods tend to result in higher malaria transmission in the subsequent following year, January to June. So very wet season is December periods tend to result in lower malaria transmission in the subsequent January to June, because December is like the month that we have more rainfall during the year. Rainfall thresholds can be determined to allow categorical forecasting. And in this case, with the product, we have high, medium, and low as indicators for malaria transmission. So what has been found is rainfall below 350 millimeter. If we have rainfall below that amount, then there is a high chance of transmitting malaria or high transmission. And rainfall above 550 millimeters, there is a low transmission. So what it's saying is more rainfall above those amount means that most breeding grounds of mosquitoes will be washed away, reducing the breeding capacity. So this information will be used to inform the climate-based malaria early warning system for the Solomon Islands, and that is where the product was created to inform the vector-borne team within the health division. However, noting that rainfall is just one of the factors which have affected malaria being transmitted, there are also other factors, but here the concentration of the research was all based on a correlation between rainfall and malaria breeding and cases. Okay, next, please. Next. So this is the malaria early warning system. We're looking at ENSO, and then ENSO we have a scope. That is a statistical tool that we have, but then now with the help of Alan and team through the dynamical modeling through Access S, they're helping us for predictability. We're now using Access S. And then also we record the rainfalls during those October, November, December to help with the verification. And then we, in simple, use dialer to give information of whether there is a high risk or medium risk or low risk of malaria transmission in the coming January to June, using October to December as the forecasting month. Okay, next one, please. Yeah, so this is again repeating what I've been saying. June to July, begin monitoring ENSO phase forecast. August, October to December, seasonal rain forecasting using Scopic, but now we're using Access S as more reliable. Then looking at Malaclim tracking tool and using it for forecasting for October to December. And then January, final malaria for forecast for January to June period. And January to June, we track the progress of malaria season using collective number of cases. And that with the collaboration with the health team, we collect the data of malaria and we do verification for those period from October to December. Okay, next please. Right. So in brief, this is the kind of like the bulletin that we disseminate to the vector-borne team, the health division. So in brief, what we have there, you have the dialer that I've been mentioning below normal risk or high risk. So this is not recent, but it gives information on the forecasting for October to December of millimeters of rainfall once it is above the thresholds that are mentioned over there. And then we say something about the chances of the high risk or normal or below risks for the coming January to June. And then a bit of information on ENSO regarding La Nina and El Nino. And then an outlook for the coming 3 months. Yes, and then there is a part where we do verification after we complete October to December, and then we verify the forecast with the data available being observed and recorded. And we see that whether we hit our target or there is a difference over there. Yeah. Okay, next please. Yes, so we have MOU with the Health Ministry. So within this MOU, it guides us on what we're supposed to do. And yes, we're doing it up until now. We just released the Malaclim or the bulletin today for the vector-borne team to use it for their purposes in controlling malaria in the coming 3 months anyway. So just quickly, we have the product over there. Around September, following year, we budget for the activities of controlling malaria start to take place. From the Met Service side, we look at rainfall observation and update the outlook. That's forecasting October to December. And then is the threshold met? And then we release bulletins throughout those months, looking at January, February, March up to June as the anti-malaria intervention monitoring tool that looks through these months. And then model can be adjusted, giving feedback during July and August. We start next preparation by September as the month that we use to forecast October and November, December. So this is kind of like the guidance in our MOU to guide us, help with the vector-borne team to help them make decisions in their programs to carry out their activities throughout the year. So that is more or less what I would like to say regarding that linkage between the Solomon Med Service and the vector-borne under the Ministry of Health. Thank you.
Thanks very much, Max. That was great. And a great real-world example, use of climate data for malaria program planning. We'd like to hear next from Dr. Leonard Boas from the National Vector Disease Control Program on the Solomon Islands, just how this works for him, how things are coordinated, and how this is used. So Leonard, would you like to give some comments? Dr. Leonard?
Yeah, sorry. Thank you. Yeah, thank you, Richard, and Maxita, my colleague from Solomon Islands, for the presentation. I think we have been working with Med Services for Solomon Islands regarding this project for quite a long time. And it was the project itself was collecting data for rainfall and malaria cases. So what we did was that the Met Services provide the rainfall data, and the malaria office provide the malaria case data, and that's where they compared the relationship between rainfall and the malaria cases. Now, on each application, I think we did receive because the data itself was collated by the Med Services, and we only rely on Med Services to give us the result of their study. So in relation to each application, I think it depends very much on what the program priorities are. especially the type of activities and the planning for implementation of activities in Guadalcanal provinces and other provinces. Now, whenever the data was given to the malaria program, for us, but the forecast is good. They can forecast that there will be a dry season in a certain period and a wet season in a certain period. Now, if you look at the malaria cases in yearly malaria cases, we have seasonal malaria cases by years. It's like a seasonal disease where we have peak malaria periods in April to June, and then from somewhere October to November. And I believe if Max can correct me, if there is a peak period between April to June, and then a peak period from October to maybe December, I think, but we normally have high malaria cases during those peak months. So depending on our operational plan, whenever the result was given to the program, because it was based only on North Guadalcanal, I think we did not give more time to look at the data itself. And for sure, as I said, even though the prediction is there for us to act, there are priorities and for other activities in some areas that are of hotspot areas. So I think, but thank you, Max, for that presentation. And I believe we can put more effort to that project. And what I think of is that if we can have early, very early data provided to the program, then probably we can plan ahead on what we need to carry out the types of intervention that we can do at the areas of concern. And I believe if we can expand it to other provinces in a wider perspective, then I think we can it can be very useful for the program to concentrate on climate data to help us reduce the malaria incidence. Thank you, Richard.
Right, thanks, Leonard. That's really good to get your perspective on it. We are just going to remind the participants to please put questions in the Q&A box, and you can vote on the questions that you'd like us to address in the panel discussion at the end. But before that, we're going to have one more talk just from Kaushik Sarkar, which is a different perspective from IMAX. Kaushik, are you able to unmute and start your talk?
Yeah. Is my screen visible?
Yes.
Perfect. So hi, everyone. Good evening, good morning, good afternoon. So you have already heard about the relationships of climate change and some of the diseases. So you know, overall, climate change introduces outsized risks to global health security. And the rise in temperature, fluctuating humidity levels, erratic rainfall patterns create an environment conducive to the spread of more than 50% of infectious diseases. Additionally, the increasing frequency and severity of extreme weather events disrupt essential healthcare services and supply chains, further amplifying the risk of outbreaks. Now, early warning and response systems, or simply early warning systems, despite having the potential to save millions through accurate prediction and responses, today suffers from three major obstacles: the fragmentation of climate and health data, the limited predictive capability of statistical models while dealing with real-world data, and the insufficient capacity of public health surveillance to generate actionable insights on climate-sensitive infectious diseases. Now, to overcome these challenges, in 2022, the Institute for Health Modeling and Climate Solutions was launched as a global center of excellence under the Forecasting Healthy Futures initiative, with startup funding from the Reaching the Last Mile. And today, I'll be talking about how IMAX is collaboratively applying digital technologies to address these problems that I mentioned in one of its flagship initiatives in Indonesia. So in 2023, building on the learnings from our foundational India work with Reaching the Last Mile support, IMAX began supporting Indonesia with a transformative initiative, Climate Smart Indonesia, embracing a broader set of objectives. Number one, improving climate-sensitive infectious disease prediction models and developing more effective response strategies. The second objective was empowering policymakers and health professionals with actionable insights derived from advanced digital technologies and robust meteorological data. And our third objective was enabling more efficient resource allocation, timely healthcare responses, and enhanced protection for the nation's population, especially the most vulnerable communities. Now, as you can see in the slide, our three-pronged strategic focus were cooperation, innovation, and application. So together with our partners, Korika, which is the AI Industry Association in Indonesia, and the Mohammed bin Zayed University of Artificial Intelligence, earlier last year, we launched a national strategic alliance with the Ministries of Health, the Ministry of Environment, Forest, and Climate Change, and the Meteorological Agency, BMKG, to collectively address the growing pressure of climate change on the infectious diseases. We sourced and harmonized a wide spectrum of data through innovative integration methods and advanced digital solutions to address the challenges that I mentioned before. Now, these are some of the tools that we developed under the Climate Smart Indonesia initiative. And at the top of this slide, you see our most sophisticated solution, a digital twin system that was built through our partnership with the MBZ UAI at UAE, that used VR technologies to bring to life the outputs of some of the most accurate and granular predictions of weather and diseases. And below, you can see more traditional data boards and dashboards as visualizations. And more importantly, behind these fancy visuals, there is a very strong prediction mechanism that we universally apply at IMAX, which I'm going to show you the next slide. So our prediction system first involves harmonization of 5 different types of data, which are subject to complex data engineering mechanisms and data science analytics to ensure that they are modeling ready. Then we apply a hybrid neural network to develop predictions around diseases, primarily to answer 3 questions: where the public health decision makers need to focus, when they should anticipate an unusual pattern of the disease, and what interventions can help in effectively addressing these diseases. Currently, with the additional support from the Patrick J. McGovern Foundation, we are decentralizing our predictive architecture through edge computing. Now, artificial intelligence is fundamentally reshaping our predictive modeling through 3 core innovations. First, As you know, traditional predictions rely heavily on statistical regression, often constrained by linear assumptions and closed form or convex solutions, with models optimized in a single pass. Deep learning disrupts this with backpropagation, a gradient-based iterative optimization technique that enables models to capture highly complex nonlinear relationships across multiple layers. And unlike regression, which requires manual feature engineering, backpropagation allows deep networks to autonomously learn intricate patterns and dependencies from data, making them far more flexible and powerful. The second advantage is multi-head attention mechanism is a special type of network. Automate feature engineering by dynamically focusing on different aspects of input data, assign contextual importance to features or variables without manual interventions. And this approach not only uncovers hidden relationships across high-dimensional data, which you often see in health and climate, but it also helps scaling effectively complex environments, drastically improving model performance and reducing the need for human-driven feature selection or variable selection. And finally, advanced ensemble and adaptive learning techniques, including encoder-decoder architecture, transfer learning, and federated learning, they elevate the predictive capabilities of these models. Ensemble models blend multiple algorithms to improve generalization and reduce bias, whereas adaptive learning continuously updates these models in response to new data. Transfer learning accelerates model development by applying pre-learned knowledge to new domains, whereas federated learning enables decentralized, privacy-preserving collaboration across dataset. So together, they form a very, very powerful tool in today's world to make predictions. And these are some of the AI-generated images of how incremental innovations in these three stages disrupt the entire predictive capabilities in today's world. As you know, that applying these complex innovations is challenging. Therefore, one needs a constellation of tools and a human-centered design of the entire technology ecosystem to ensure this transformation. These tools are data integration solutions, modeling tools, and middlewares, front ends at mobile and web, more advanced technologies like digital twin systems, the one that you saw earlier. And at the back end of these tools, you need a strong technical capacity that can serve as the engine and a local alliance that brings to that, helps in collaborating parties and stakeholders to support and fuel the innovation. And finally, as I always say, in addition to these technologies, AI requires a strong agreed upon purpose. And that purpose comes from cooperation, capacity strengthening, advocacy. In Indonesia, we have worked with our partners to achieve a strong buy-in from the government, while our teams are still working on enhancing capacity as we have started indulging in complex processes of technology transfer. So with that, I sincerely thank you for your patience and happy to answer any questions you might have and the moderators recommend. Thank you.
Right, thank you for that. So another fantastic example and a very different technological solution to using climate data for malaria program planning. We are going to go to the panel discussion next. We have about 15 minutes. So if I can ask the panelists to put on their video if they're able to. And I'm going to go to the Q&A. So the questions in the Q&A, please feel free, participants, to keep putting questions in there and you're welcome to vote. But first, I'm going to go to Professor Hillary. There's been a few questions about the use of other types of data. So mentioning climate data, but asking about other factors, and particularly human factors as well, and how that could possibly be incorporated into this sort of work.
Right. Yeah, look, very, very complicated. I think working in the area of vector-borne disease and climate change is possibly one of the most complicated epidemiological areas you could choose. And obviously, because that is for the ecological environment, if you like, the ecosystem that we've got to think about with vectors and hosts and so on, microclimates, and particularly human behavior as well. So I think with things like dengue, for example, we've certainly seen where even just the socioeconomic status of a community makes such a difference as to whether or not they've got high rates of dengue. So look, bringing that into the modelling is certainly very difficult. And what what everyone mostly does here is assume business as usual. That the current or the past patterns will of sort of everything else being equal and only climate changes, these are the sorts of impacts that we might see on transmission, for example, in the future. So, I guess incorporating that human side into it, it would be needing to pick particular behaviours, perhaps. With malaria, I suppose the use of bed nets, you could do modelling with or without bed nets, for example, in certain areas where that's seen to be effective. So I know that's not a very satisfying answer, Richard. I'm afraid it's something that I think is extraordinarily difficult to do, but I think that's where working with local communities and local knowledge, and working out with communities about what would be feasible interventions in those areas, and seeing if they could be incorporated into those models for those areas. And I guess again, that highlights the variability, that what might be an acceptable practice or easy to do in one region may not be easy to do elsewhere for various regions. So all I can say is, local knowledge where you can, to incorporate into models for those areas.
Great, thank you. And I guess to be able to do that, whatever it is has to be measured well enough to include it.
Yeah, and look, I mean, we're all aware, anyone working in this area is aware of how imperfect data is as well. Whether it's climate data or notification data at both ends, it's quite imperfect.
Thank you. So next up, I'd like to turn to Alan. Maybe can you put your camera on? So Alan, there's a theme amongst the questions as well, just about different types of climate data and different climate factors and how to use them. But I guess there's short-term prediction and there's also the longer-term impact of climate change. So I just wonder if you'd like to comment a bit on those different types of climate data and how they might be used.
Yes, as Max has clearly shown, this is very much a seasonal and monthly total kind of, or annual total kind of approach. So it's very coarse. And there have been obviously interventions like, as Elizabeth mentioned, bed nets and things like that. So the model doesn't take that into account. This work is constrained by, the normal factors of constraints on the data and financial issues with project funding. So there's huge potential to develop this further. We have a running model in a cloud-based platform, which works really well. But we do need to start thinking about, diurnal variation in temperature and things like that, and looking at other locations. The problem we had with the science was that the model only worked really well in a very localized area, which was a swampy area, as Max described. In other parts of the country, the model didn't work very well at all. So, lots of things to think about and to try in this space. But we do have quite long climate records now, so we have good background data to do some more work on this.
Right, thank you. So maybe I'll just ask Kaushik a bit more about his work and just how these sorts of models can inform malaria program activities, particularly implementation of interventions. There's a question about that from Jeffrey. Potentially, how could you guide the timing of mass distribution of bed nets or active case detection campaigns?
Yeah, so I guess the answer might come from our India work. So when we applied the artificial intelligence model, we call this intervention set as precision programming or precision public health. And in precision public health, you apart from just looking at the problems, you also look into the prescriptive part of prediction. What you saw in my screen were more of a predictive part of the output of the models. And when we applied prescriptive predictions, for example, how many bed nets you might require, how many rapid diagnostic tests are required on ground, where your surveillance need to focus, we found that in a couple of years' time, with the same routine interventions, malaria could be reduced by over 50% in a population of 2 million. And the fever surveillance during the same period could be increased by over 30% in the same place. So when you apply the routine interventions in a more targeted manner and in a more anticipatory manner, so that your resources are being used more efficiently, and and you are applying those to places where they're most needed, the effectiveness and the cost both will be improving. So the cost will get reduced, and the efficiency of the program, or the effectiveness of the program, will get improved. And there are, today proven evidences of that.
Right, thank you. I'm going to turn to Max next. So there's been a lot of interest in your observation, Max, that lower rainfall predicts more malaria and vice versa. And thank you very much for responding in the texts. But maybe if you can say a bit more about why that relationship's happening. So you're getting a drier dry season, and then more cases the following year.
Thank you. If I will explain it to answer your question. So the idea here is like my other colleague from health has mentioned. We noticed that October, November, December, like the peak periods of having malaria. And that is due to, if we were relating it to rainfall, it's just the breeding grounds that we're trying to see if it can be minimized through this flash flooding out of the breeding grounds of mosquito during those seasons. So if there is higher rainfall during those seasons, then those breeding grounds will be disturbed and washed away. So the malaria cases in the following years, as January going to June, kind of like a prediction that now that more rainfall during our wet season over here, it will be more washing away of these mosquito breeding grounds, no more much of a stale kind of a wet area that allows mosquito to breed until they reach the stage where they go and start causing infections. And that kind of like gives the prediction for the cases in the next following year, and looking at January to June. So that is why we kind of like consider October, November, December to use as a predictability. We predict, it is not the observed, we predict it, and then give the outlook for the chances of cases being higher than normal, or being as normal cases during those period, or expecting below normal. And when that time comes, like Alan has mentioned, the model needs to consider other factors, that sometimes we get a hit, or sometimes there's a different story altogether when cases are observed, recorded, and then we compare with the forecasted cases that we have put forward and the rainfall values that we put forward. And again, we also need now to also consider thresholds changing, because again, the output based on the above threshold and the below threshold of rainfall. So from time to time, probably need to look again into these thresholds and make changes to them. Otherwise, there are some years that we get a total different forecast and the observed both telling not good stories, but at times they are really helpful. They almost, when the observed data or the observed malaria cases come out, and we look at our forecasted cases, oh yes, we are within the range. The idea here is now it helps the vector-borne to plan and try to mitigate or try to reduce our forecasted cases that we expect to happen through their various activities like mosquito nets, injections, spraying, and that helps them along those activities. Yeah. So that is why we more or less look at October, November, December to determine the cases that will be outcome in January, February up to June. I think that is what I can say for now. Yeah.
Fantastic, thank you.
Yeah.
Okay, I'd like to go back to Dr. Leonard next, and just to ask a bit more about what your plans and ambitions are for this programme. So just looking to the future, how would you like to be using climate data in the national programme? Dr. Leonard, are you still there?
Yeah, thank you, Richard. Can I have a question again, please?
Just to ask you what you're seeing for the future for this programme and how you would like to use climate data going forwards in the national programme.
Yeah, okay, thank you. Currently, I think we depend too much on the malaria information system, where we prioritize our intervention or implementation of control activities without realizing that I think that climate change do contribute a lot to the resurgence of malaria in the country. So if we can improve on what Max and Alan, Professor Alan are doing, maybe in forecasting, like what Max have said, that if there is a wet season in October to December, then there is always a flash flooding of the mosquito breeding sites. So after the flash flooding, there will be so many pockets of water remaining, especially because we have our Anopheles mosquitoes that are breeding on streams. Yeah. So during the dry season, streams will not be running, and there will be pockets of still water that can encourage mosquitoes to breed and continue the transmission of malaria. So probably that's why in April, May, June, we have so many transmission that we have a malaria peak in those period of time. And to make use of the data that is collected from the early warning system that I think Alan and Max are planning to improve on the project. And then I think to move forward, the program should be looking at what the product is from the project, then consider it as important and make use of it for implementation of our intervention to control transmission. Thank you.
Right, thank you very much. So we got a couple of minutes before we have to close, but maybe I just ask Professor Hillary just to think quickly of a closing remark while we pop up the feedback question on the screen. But particularly thinking about the future of this field, where do you think things are heading to? What's the vision going forwards?
I'm afraid it brings us back to complexity. I've noticed a few comments in the Q&A or in the chat about unexpected results in terms of seasons and so on. So, you know, again, I think we need to get the granularity right when we're doing this kind of work. And, you know, it is a challenge when it comes to climate data in particular, and having suitable, you know, particularly forecasting data, having that available at a suitable granularity, which you know, at the level at which the infections happen, the transmission happens. So I guess what we will see, and you know, perhaps this is an area where AI can help as well. You know, we'll see sort of decreasing spatial sort of units in which we can make these sorts of predictions into the future. So I guess that's a good thing, but you know, again, very complex, and everywhere has its own challenges that are quite distinct.
Great, thank you. It's a fantastic summary. Lots of ambition and lots of challenges going forwards, but it's certainly a very big, well-supported area. There's a lot of funding appearing for the academic sphere, and a lot of interest across different countries, and multi-ministry efforts starting to happen. So we've just put a pop-up to ask for your feedback. So if you can just fill in that questionnaire very quickly. It's only 3 questions, so it shouldn't take too long. And while you're doing that, I'd like to thank our speakers and our panelists. We're going to talk more about this in our annual meeting coming up later this month in Kuching. We're going to have national programs in the room discussing the use of climate data, and it's certainly a topic that admin will keep focusing on for the coming years. So I'd just like to thank everybody for your participation, and I'll give you another minute to fill in this questionnaire.